Okay, so in today's video, we're following up on some videos we did last week that were talking about network benefits and specifically provider contracting. So we did a conceptual overview of how provider contracting works, and in this video, we wanted to kind of just sort of give some illustrations of some actual real-world examples of that. But before I jump into an explanation of the data that you're looking at here, uh, to explain the challenge with this issue, the provider negotiated discounts are a big part of how insurance companies compete with each other in order to get their pricing. And so getting that data is very difficult. In my perfect world, I'd have a data set that was made up of EOBs, explanations of benefits. Those are statements you usually get from your insurance company after you have some sort of a medical event. You go to the doctor, you'll usually get a bill from the doctor, and you'll get an explanation of benefits as well. In that explanation of benefits, you'll get, an itemization of where you went, the date you went, the procedure you received, the billing code, and then some financial columns that will tell you about, okay, this is what the provider's bill charge was, and this is what the allowable amount was. That would be my ideal data set for working with this information and trying to answer the questions. But since we don't have that, what I'm working with is a study that's being done in Texas. So it's being done by the University of Texas School of Public Health, and they're publishing their data on the Texas Department of Insurance website. So I've pulled that data. It's public data, and they haven't necessarily been intending to answer the specific question. I don't think that I'm asking, but they're asking questions about insurance pricing and insurance payments and member payments to medical providers. And so what they've done is they've taken Texas and broken it up into a number of regions, and then they've taken CPT codes for those regions and averaged them. Said, okay, or prices for CPT codes and average them. So you say, okay, look, you pick an area, and I don't know what the sample size is for each area, but say there's a dozen or so, or maybe more CPT codes that were billed. This was the average amount that they were billed in that area, and then this column right here is a column that from the original data set that explained how much was paid to the medical provider by both insurance company money and member money. And again, this is average, so we're comparing averages against averages. So it's not a perfect explanation of what the negotiated rate was, but I think it's a good starting point for approximating, because it's including the amounts paid by both the member and the insurance company, which in theory would be the contracted amount. But again, because we're working with averages, there's going to be some distortion within the numbers, but it still gives us a rough idea and a starting point. And for lack of better data right now, this is what I'm going to show. So these two columns here are columns that I generated, so they were not part of the original study. I've just added them in, and what I'm showing is the differential both in terms of percentage and in terms of dollars. And to be specific with the percentages, the way these numbers are derived, I'll use this column, the top row here first, or only. What we do is we take the average amount billed in network, so this column here, the 109 and 12, and subtract from it the amount, the contracted average in network, so the amount paid by both insurance companies and members, and then we divide that by the amount billed by the provider. And the reason I'm doing that is to show how much was written off of this original $109.12. So out of the $109.12, 57% was discounted, was written off. And so the member only ended up paying $46, or it would work out somewhere in the neighborhood of 43, 42%. So this column here is the amount that was written off. What it's not saying is $46 is not 57% of 109. It's about 43%. 57% was the amount, is the difference between these two, divided by the amount billed. But anyways, so here's our data set. Some other things to know about the data. The original data set is a sample size of about 3,600, so that's what this is here, and it's how many columns it initially had, and I've pulled a few out because they weren't necessary here. I've taken out any column that didn't have data in both the build-in average in network and the contract average in network. And so when I did that, we ended up with about a lesser sample size of still about 1,084. So to get into the analysis of it, you can kind of see what the numbers were on the page here. You can say, okay, look, I can see kind of how much was written off as I scroll down, but that's obviously hard to appreciate with that kind of volume. So first thing we've done is we've normal tested it, and or at least normed it, and you can see we've got a roughly normal distribution, or a normal bell curve shape. I'm seeing a slight skew in there. It looks like it's a little bit of a left skew, and so what that means is that the probabilities are probably not going to be evenly distributed from the mean. So the average right here, it seems like we're going to see a little bit more weight probabilistically between 30 and 60% than maybe 60% and 80%, but it still gives us something to work with there. And then here's the hard statistics. So we're seeing based on this sample, kind of a central tendency there in the 60% neighborhood, meaning that the average in the mean here says that roughly about 60% on average is written off from this study, and you've got variation sitting there, standard deviation sitting there at about 12%. So put the plus or minus at 84 to 33. I don't know that I would weight it that way. I'd probably say it's probably hit closer to the more of the weighting is in this area here again than this area. But why do I show this? It's a starting point to just get an idea with some real numbers of what kinds of prices are we looking at with regards to insurance discounts. I don't know that the particular study, or at least my take on the study, is good enough for science journals. I wouldn't publish these as saying, hey, look, on average this is how much is written off because of this study that I analyzed from the University of Texas. But I would say that looking at the numbers, if you said, okay, well, what could happen? My insurance company is negotiating with a provider. What kinds of numbers could we be looking at? I think this still gives you sort of a feel to say that if nothing else, the discounts can be very significant. That's probably what I would say is that they you think my intuitions would be, well, okay, they've negotiated a contract where they're knocking off 10%, 15%. So no, it's probably more realistic to say it's 20, 30%. Is probably more realistic, maybe even 40, 50% than 5 or 10%. But I think we've put some measure of scale on there, but I would like to have better data to answer this question a little bit more rigorously. But anyways, in the next videos we'll do some modeling, and the models won't necessarily depend on these assumptions. We can use them, but we can test in and out of those assumptions as well. So we'll get to that in the next video, and we'll catch you there. See ya.